Thank you for the video. Ladies and gentlemen, let us begin our second session. The title is Aviation Health Safety During the COVID-19 Pandemic. Questions for a session can be submitted through the QR code on the screen and as well Q&A link on YouTube. See more. In this session, I would like to introduce our moderator, President Nabil Naoumi, Air Navigation Commission, ICAO. Please welcome President Nabil Naoumi joining us online. Hello.
Thank you very much. Good afternoon, good evening, and good morning, ladies and gentlemen. And welcome to the second session of this important seminar. First of all, I would like to thank Minister Kim, Minister Park, and of course the Korean government for the kind invitation and for the great organization of this important seminar. So in session 2, we are going to talk about the aviation health safety during the COVID-19 pandemic. We got for you 5 guests to talk about the perspective of Korea regarding COVID-19 and safe air travel. This will be Mrs. Jung-Hawa Son, the Deputy Director, Aviation Safety Policy and Licensing Division from the Morit Republic of Korea, to talk about aviation health safety protocols for passengers and operations. Is with us Javier Fesedo, the representative of EASA to China and North Asia. We also have Mr. Hassan Shahidi to talk about the multi-layered approach to reducing COVID-19 risk in air travel. Mr. Hassan is the President and CEO of Flight Safety Foundation. Mr. Suman Kwon, Professor, Health Economics and Policy Lab, Graduate School of Public Health from Seoul National University, to discuss how to balance between public health and aviation recovery. And last but not least, Hyung-Min Lee, Professor from Department of Laboratory Medicine, Yonsei Severance Hospital, Republic of Korea, to address concerns on COVID-19 risk spread with aviation recovery. I'm not going to talk much. I would like to listen more to our guests, and I would like to start with Mrs. Jung-Hawa's son. Mrs. Jung-Hawa, the floor is yours, please.
Thank you, Mr. Moderator. Thank you, Mr. Shahidi from Washington, and Javier from Beijing, and Mr. Kwon and Mr. Lee. Good afternoon, good morning, and good evening, everybody. I'm Claire Kyung-Hwa-Son, working for the Korean government, being in charge for the aviation safety policy. I'm very pleased to be present here in such a meaningful event. Before my presentation, I would like to take this opportunity to thank all aviation personnel and industry partners working in the front line fighting against the COVID-19 for the aviation recovery. This slide shows the changes in air transport market of Korea affected by the COVID-19. Starting with the first patient who arrived from abroad via Incheon International Airport on 19th February, Korea is experiencing the third wave following the first in February and the second one in August. As of the 30th November, about 36,000 people have been confirmed positive. As a result in aviation, more than 90% of the international passengers flights have been grounded, and 140 aircrafts are currently in the storage phase. Despite the government's financial support, approximately 50% of those in the air transport industry are on leave, and some airlines are facing merger due to financial difficulties. Maybe we are all refraining from moving out due to the COVID-19 risk, and for aviation especially, we have 14 days mandatory quarantines for inbound travelers and a border lockdown for some states also. I'm sure some of you here would find aircraft very safe thanks to its high-quality air purification system, but it might be a different story for passengers. From their perspective, aircraft cabin could be a very limited space, confined with multinational travelers, where they have to eat and sleep for an extended time in the case of the long-haul flights. So for that reason, aircraft could easily be perceived as an uneasy place to protect themselves from the virus. However, we cannot afford to put our society and economy into severe restrictions. The aviation authorities, therefore, should do everything in its power to minimize the in-flight risk to free passengers and crew members from any concern of the infection. So to reduce the risk during in-flight, the Korean government is recommending its air operators and the passengers to implement the aviation health safety protocols. The protocols related to flight operation in Korea consist of 4 categories: passenger, crew, cockpit and cabin, and aircraft are those. It is prepared in accordance with the laws and guidances published by the Korean Public Health Authority in alignment with international recommendation issued by the WHO and the ICAO. In order to ensure the free service activities of the air operators as much as possible, it is recommended to flexibly apply the procedures in accordance with the social distancing level, flight time, and load factor of each flight. Moreover, we are managing this risk in association with the safety risk not to compromise with the flight safety. You can see the contents of aviation health safety protocols on the screen. Passengers are required to wear masks and sanitize their hands on a regular basis. Temperature checking is mandatory before boarding in Korea and even in the flights departed from other states bound for Korea. There is also a separate guide ready for onboard distancing and lavatory use for its nature of communal space. It is recommended for crews to wear masks and PPEs, and we recommend crews to designate a lavatory reserved for their exclusive use, exclusive use and distancing with passengers during their cabin services, and continuous monitoring on their own health during daily life and layovers is also required, as they are the exceptions for the 14 days quarantines. Casual cleaning and disinfection should be regularly carried out in the cockpit and cabin during in-flight, and passengers and crews are advised to minimize their movement and remain within their designated area. Isolation area in cabin should be designated for possible suspected cases on board, and sealed meals and simplified beddings are also recommended as a safety measure. Disinfection for entire aircraft is encouraged, and alongside the proper maintenance for air conditioning system. Implementing these protocols, could be challenges for passengers and crews also. For passenger first, during the pandemic, passengers are encouraged not to remain as passive recipients of the service. They should practice active quarantine measures for their own health and safety as directed by the crew and the government explanation card. In addition, they need to understand necessary cabin rules such as crew-only lavatories to allow safe and supportive service environment. It's important that everybody understands their own share of responsibility in fighting against the COVID-19. In the case of flight crews, a greater focus should be given to disinfection in implementing pilot incapacitation prevention program. In particular, relevant procedures should be prepared in advance for any possible cases of symptomatic flight crews on duty. Balanced approach between wearing masks and effective communication with the ATC or having CRM in the cockpit could be also challenges for them. Similar to the flight crews, new competencies are required for cabin crews also. They need to build capability to balance their work to protect the safety passengers, sometimes including symptomatic personnel, while taking care of their own health. Well understood use on the universal precaution kit is required for the cabin crews also. And also, distancing, sanitation during layovers are very much emphasized for them. Obviously, this change in travel environment is unfamiliar and very difficult for all of us. The good news is that several vaccines are being rolled out. However, until the day the world successfully developed antibodies against COVID-19, we should not become complacent and continue to be vigilant, actively implementing quarantine measures for our own safety and the aviation recovery. The Korean government will continue to expand its support for industry and aviation personnel who are experiencing difficulties due to the prolonged COVID-19. We are receiving voluntary safety reports for identification of latent issues and are under review for further support for health issues for the aviation personnel. And we will carry on with creating and promoting in-flight quarantine culture so that people can board the aircraft with confidence. In addition, we will remain committed to supporting the initiatives of the international organizations such as WHO and ICAO for their effective and successful leadership. Thank you. Thank you, Mr. Moderator.
Thank you very much, Kyungawa. Thank you, Mrs. Sun. A very good and very structured presentation. I'll give the floor immediately to the next speaker. We will take the questions at the end. The next speaker is Mr. Javier Bichedo. Javier, please.
Hi, hello everybody. Nice to be here with all of you. I'd like to thank Molet and all of those involved in preparing for this event. Certainly a large crowd, I understand. Also like to thank my moderator, especially I believe being in Canada time right now, if I'm not mistaken. So thank you for being there. Thank you for moderating this, and thanks for all the panelists as well for joining. Before I move to the next slide, I just wanted to quickly introduce the European Union Aviation Safety Agency. So we are the main regulatory agency for European products in aviation products. So it's our certificates that accompany Airbuses and Airbus helicopters and Leonardo helicopters that some of you are familiar, as well as we draft regulations in domains like traffic management, pilot licensing, and the like. We are very proud to be here, and more proud even to work with institutions such as Molet, with whom, despite this the setback of COVID, we have managed as well this year to continue our cooperation, notably in the production of helicopters, as well as recently in starting cooperation on urban air mobility, taking the advantage of the KUAM program going on launched recently by the government of the Republic of Korea. So again, very proud to be here today and be a partner to Molet's initiatives always. Next slide, please. So Claire just mentioned, our previous speaker just mentioned the approach when it comes to passengers in cruise and the like. You will see similar things in our regulations. And in fact, for you to know, we work closely with Molet, and we're very happy to have received from that information back when all this started, that we incorporated it and after shared. So this being a progress with amongst the community sharing to build common standards, hopefully to respond to the needs of the industry. As, by the way, was mentioned by a speaker in the previous session from IATA, the idea of making common standards so passengers and operators can know what to expect whenever they fly in this very international environment. Now in Europe, our approach is based on 4 pillars. So 4 pillars or 4 levers that raise, hopefully, to restore the industry to its glory. So the first you'll see on top is the reduction of travel restrictions. Europe being a large institution composed of 27 states requires great coordination, and travel restrictions are often the remit of every country. So for that purpose, the European Commission has tried to always align and put at the disposal of passengers enough information so that decisions can be made and enough homogeneity can be built across member states. On the left side, you also see something, say, resumption of industry. There is, with the downturn that this industry has suffered, there's been a lot of distress. We know how many people have suffered, not just of the illness, but also of the uncertainty of their jobs. And this is also very true in our industry. Recovering from this, putting back the aircraft in a state of operations, as well as getting people back into alert, being properly alerted, properly ready to take these responsibilities is something that we take very seriously. And for that, we've done studies, and I will talk about it in a minute as well. Then on the right side, it's more a topic as well of this session, it's the idea of health measures. You will see what we've done in this regard, including some testing recommendations that came just as recent as last week. And finally, a fourth initiative, which is how to ensure the engagement of stakeholders in precisely those same measures. Can I have the next slide, please? Thank you. So in a very latest, we are now also launching the passenger locator form project, the idea that people traveling across Europe can share the same level can input the same level of data on a digital PLF, so it can be shared across all member states to support the management of outbreaks through contact tracing. Then, as I mentioned earlier, the impact on aviation recovery, how to monitor those risks related to getting back to business. We updated recently the Aviation Health Safety Protocol and other publications, and you will see some of the modifications right now. And as always, trying to harmonize across Europe the guidelines for this, to deal with this pandemic, including in this case, testing and quarantine. Now, these are challenging times. We are learning as well to work. And while there's only one EASA in Europe, we have numerous health institutions and health ministries with whom we've had to work as well. Thank you to what you see in the third bullet point, the Ecdc, meaning the European Centre for Disease Control. Next slide. So mentioned earlier about the risk portfolio and mitigation. This is something that we want to share profoundly with all countries across the world, and we also read as well from them. We take all the information possible. This idea of how will people get back to work? How are they? What we should be looking at? There are examples of aircraft, things that have been discovered on aircraft that because aircraft used to be used regularly, only after leaving them a week without using or a month or whatever, we may find things that actually deteriorated we would never expected. This type of examples are things that have alerted many of our colleagues to just make sure that when we all go back to from 10, 20, 30%, we go back to 80 or 90%, all our aircraft, all our personnel is competent and ready to resume in a safe manner. On the focus areas here listed are some of the things that we're starting to identify and that we're working on to making sure that staff well-being is there, not influencing performance, that things like unstabilized approaches, aircraft airworthiness, and of course the return of aircraft from storage, how to handle those in a safe manner, making sure that nothing is missed. And also this period has also shed some evidence on perhaps some of the robustness of some of the management systems. So we can see a lot of areas also in which we will get better thanks also to what we learned from this experience. Next slide. So talked earlier about the EASA Ecdc Aviation Health Safety Protocol. So if I have the next slide. Can I get the next slide, please? Oh, thank you. So this document was published. Its first version was published around May. In it, we included a series of recommendations for member states to adopt. Our previous speaker just mentioned many of the things that you now see when you go to airports. Again, we work closely with partners, including Molly on this, to learn from each other. The idea was to provide a one-stop shop, one single document that all the industry could just look at, in Europe at least, could just look at and try to understand. So things like, should there be thermal screening? What type of recommendation for wearing a mask? What distance? How to handle flows of people? How to handle crews? How to handle passengers? All those things were contained in this document, published around May, I believe. There's been several revisions, and the latest was just published recently, making some changes, some amendments, as well, in particular, to add a new addendum in testing that I will talk of in the next slides. Now, we also reviewed, and we will continue to review, some of the safety directives and guidance materials. I'll explain you why in a minute. But I give you as an example, you know how many of you working in airlines have seen packages being carried on passenger jets, all those modifications to aircraft required, all those assessments we've had to make as well, and publish them. As we continue to look at things like de-storaging aircraft, there'll be more and more of these documents coming out to make sure that all the industry continues to follow and get sufficient material to make sure that when they operate, they do so in a safe manner. Can I have the next slide, please? Yes, so I talked earlier on the new addendum to the testing and, the Aviation Health Safety Protocol. This is about testing and quarantine. I would not want to dwell. I just want to share with you that this is a document that is produced in Europe. Europe now is right now coming out of seeing the back end of our second wave. So what you see here is today it was published last week. The idea is this should be of help as we all come out from that second wave in Europe, and to get from what is a community transmission perhaps to a more localized, which can be dealt with through contact tracing, for instance. So in those type of contexts, we start to see that today, for instance, in Europe, we do consider that dealing with travelers as a high-risk population is perhaps not as appropriate as unless they've been in contact with a confirmed positive case. After all, with community spread in areas, it's somehow risky perhaps to devote so many resources to put in an airport if they could be just kept for the actual monitoring in the main urban areas as well. We do think that the prevalence of COVID in travelers is very low, and the like. So this is the situation, the amendment. Next slide, please. In essence, a thing you will be seeing more and more of is the idea of creating risk levels and risk zones. So when traveling from a high-risk area to a low-risk area here, one could argue that testing is required as well as quarantine, especially in the low-risk area, and there's been eliminated to nearly zero. As one starts touching medium risk and low risk, traveling to other areas, perhaps here the testing should be less systematic. And now, finally, to wrap my presentation, if I can have the last slide.
30 seconds, please, Javier.
Sorry, this is the one before second. What I think is very important for us in Europe is to make sure that industry implements the regulations or the recommendations, or at least we get to learn to. And we can't do that in Europe just by enacting law throughout member states. It will be much too costly, much too time consuming. So instead, we came with this idea of creating an aviation industry charter, whereby airlines and airports that want to join, they join with the intention to adhere or to implement all those recommendations provided, like distance, wearing of masks on board and the like, and then provide us feedback and suggest some improvements. I'm proud to say that we have, I think at this point, probably close to 100 members, including Korean participants as well, we're very proud of that support, because it helps us as well to emerge out of this in a more in a way that we've all using the same standards across. So we also learn and we modify, as I mentioned earlier. And finally, the last slide, if I'm not mistaken. Yes. So as we move forward from now on, we're also starting to hear about vaccine transportation. So be reassured, we've already started working to incorporate those aspects. So all of you that intend to carry this in your operations will be having enough sufficient guiding material to know how to do so. Again, thanks for everything. This is my input for today. I welcome any questions later on. Thank you.
Thank you very much, Javier. I have now Hassan Shahidi, who would like to talk about the multi-layered approach to reducing COVID-19 risk in air travel. Hassan, please.
Well, thank you so much, and thank you for the invitation and the opportunity to speak at the Aviation Tourism Recovery Forum. This is a very timely and important gathering, and with excellent expertise, and it's so good to see all my good friends and colleagues from around the world, and let's all wish and hope that soon we will meet together in person in Seoul. So with that, next slide, please. So at the beginning of the pandemic, the Flight Safety Foundation established a COVID-19 task force and called for international cooperation in response to COVID-19. The foundation highlighted the need to act with urgency, and that has been discussed with all of the efforts of the international partners to address COVID risk on the aviation sector. And the impact at the regional level and the global level has been discussed already in the previous panel. Next slide, please. The foundation released several papers and documents dealing with reducing the risk of COVID-19 within the aviation ecosystem. Now, this included a white paper on multi-layered approach to reducing the risk of transmission, which is very much consistent and synergistic with all of the efforts of the international partners, including ICAO. Now, there are 4 elements in this ecosystem that, when integrated together, will provide maximum effect. And these have been discussed: airline passenger hygiene practices, aircraft cabin air quality, passenger actions, and airport hygiene practices. Now, the Flight Safety Foundation has been monitoring these practices in Korea, and happy to report that these practices have been carried out very well indeed. I will briefly discuss each of these, and I do realize that we're running a little bit short of time, so my colleagues have already talked about these, and I will go through them very briefly. Next slide, please. So this is really dealing with airline procedures. My good friends at IATA have been doing a fantastic job. Clifford, good to see you. These are some of the practices that have been, in fact, implemented very well and continuing to be implemented. Contactless check-in, face masks, of course, have been talked about. Flight attendants and crew wearing face masks and gloves. Improved boarding and deplaning procedures, very, very important. In-flight service, new processes with respect to reducing those, or some cases eliminating. Enhancing more frequent cabin cleaning and disinfection, and of course training the ground crew and the ground staff to making sure that those practices are up to date. And finally, new technologies such as UV lights that are being implemented. Next slide, please. Improved airport procedures. As I said, this is an important part of the ecosystem. Facility cleaning, hand sanitizers being available throughout the airport area, plexiglass shields at all of the different areas, in immigration and at the counters, very important. Physical layout that has been changed to maximize physical distancing. Again, wear face masks, coverings within the airport area, screening procedures that have been implemented, and we've seen those. And of course, the very good work of the ACI with the health accreditation program that has been done to ensure airport health measures are aligned with international guidelines, those coming out of ICAO. Next slide, please. This has been discussed in the previous panel with respect to the cabin air quality. This is, of course, a very good quality compared to many other environments. The air exchanged every 2 or 3 minutes. The HEPA filters that has been discussed very widely with respect to being effective in removing viruses and bacteria. Airflow within the cabin, which is floor to ceiling, which really helps with preventing from the spread of the droplets. High seat backs that really will help with the mitigating the spread. And then the computational fluid dynamics that was discussed in the previous panel, some very good studies there. I won't talk about it. And the OEMs really working together with airlines with effective cleaning procedures and technologies. So a very important piece. Next slide, please. The foundation published golden rules for healthy travel. And this is what was discussed by my good friend Masson earlier, which has to be with the role of the passengers in this new world that we're living in. There is responsibility, and we outlined those. And you can see here what those are. If you're ill, do not travel. Wear face masks. Be responsible for your own hygiene as well. Be proactive. These things are outlined here. I won't go through them in the interest of time. I hope we can get to some of these discussions, but you can see how important the passenger role is as part of this ecosystem. They all must work together, and passengers are now an active participant in making sure that the journey is safe for everybody. Next slide, please. In conclusion, and I think it has been discussed very well, the way for this to work, and it has worked very well in Korea with all of the collaboration that has happened, it's the importance of all the stakeholders working together. And as you can see, there are many different stakeholders: airports, airlines, international organizations, regulators, health organizations, sharing information and working together to move forward. And very well soon we can have recovery and resume of the air transportation sector. Next slide. Let me just thank once again this fantastic event and organizers, and I look forward to the questions.
Awesome. Thank you very much, Hassan. Thank you very much. The next presenter, Mr. Sulman Noon. Sulman would like to explain to us how to balance between public health and aviation recovery. Sulman, the floor is yours.
Thank you. Thank you for inviting me to this meeting. Sorry, but I'm not an expert in aviation industry, although I'm a very frequent flyer. So I have just a few comments as a health economist. I mean, these days, I think the whole industry is having a very tough time. Not really because people do not understand that the cabin environment or airport are safer. I think most people understand that they are more safe than other public places. But in this current situation, that there is many countries around the world are already experiencing a third wave. People are afraid of traveling. I mean, in other words, I know that the traveling from Korea, I mean, the aircraft itself, and airport in Korea and airport in the US, for example, can be safe, but People do not want to travel around the US these days. I mean, just for example of one country. So we probably need to wait for a bit longer time until the whole world is safe, because no one is safe until everybody is safe under this global economy and global society. But still, I think, we need to be very vigilant, but we should have an accurate perception on risk. I mean, that's my view. In other words, I mean, of course, if people are underestimating the risk of COVID-19, then that will be disastrous. But at the same time, we hope that people do not overestimating the risk of COVID-19. So we should do our best to provide a correct message and help people have a correct risk perception with regard to COVID-19. And also as a social scientist or economist, I do think that saving lives is not the most important goal, because as a society or as a government, we have both goals: saving lives and at the same time saving livelihood. Because some people die from COVID-19, but also other people can die of poverty, hunger, when there is too much restrictions. So I think the government or society should have a balanced view between this saving lives and saving livelihood, because it's not practical to pursue the goal of risk zero society. We are always surrounded by risk, but our goal is to calculate based on some evidence, and as a society agree on what is the acceptable risk. Because as I mentioned, the risk zero is not doesn't exist in our society, or maybe to making the risk to zero maybe too costly from a societal perspective. So that's my view. And second, we need to listen to the new evidences. For example, these days there are increasing amount of evidence showing that 14-day or 2 weeks of quarantine may not be necessary. So like a week or 10 days quarantine time can be enough. So of course it depends on many contexts, but we need to take into account these type of new evidences and then fine-tune the policy. Then this type of policy can ease the burden on the aviation industry. Another thing is that the role of testing, as you all know, that the COVID-19, there were a lot of asymptomatic patients. So testing regime is quite important. My colleague Professor Lee will talk more on this testing after me. But like a testing, the conventional or most accurate and popular testing is the PCR testing. I mean, no dispute. I think that type of testing, PCR testing, is important from a medical perspective, but I think for aviation industry perspective, I think we can think about alternative testing regime like a rapid antigen testing, because in terms of a medical treatment purpose, PCR is better, but in terms of check the contagiousness or from the perspective of cost, low cost and easiness to use this type of rapid antigen test, I think we can think positively on the use of rapid antigen test at airport or before departure or after arrival. So there are a lot of literatures showing that this type of rapid antigen testing can be quite effective and cost effective in the non-clinical settings. I'm saying that in the hospital or treatment clinical settings, PCR should be, but for other purposes, for like aviation industry perspective, this type of alternative testing regime might be, it's worthwhile to consider. My last point is the role of collaboration across countries. I mean, one of the previous presenter already mentioned the importance of coordination, collaboration in the quarantine regime or testing regime or border control regime, because there are a lot of reciprocal components around the countries. But there are also other collaboration regime, which may not be quite familiar to you here in this place. But as I mentioned earlier, this COVID-19, no country is safe until every country is safe in the globe. So in that sense, I mean, in the past, many high-income countries work a lot in supporting or providing aid to low-income countries, more from a philanthropic or equity perspective. But in this COVID-19, in addition to the equity or philanthropic perspective, there's really efficiency argument for high-income countries to support and help the low-income countries. So I would like to really suggest and consider that high-income countries should be more actively supporting like vaccines to low-income countries, because when the low-income countries still suffer from COVID-19, other high-income countries the war with COVID-19 can never be over. So even from an efficiency perspective, I think that high-income countries should provide more support for the vaccine development and vaccine distribution to low and middle-income countries. That might be a big help to the aviation industry. Thank you. It's over. The end of my short comments.
Thank you very much, Salman. Very interesting perspective. Thank you very much for sharing this with us. And we're looking for the Q&A later to come back to you. The next, our next guest is Hyung-Min Lee, Professor Lee, so to talk to us about the concerns on COVID-19 spread with aviation recovery. Hyung-Min, please.
Thank you for nice introduction. My name is Hyung-Min Lee and work for Severance Hospital as a rep physician who major in clinical microbiology. I'm reading a COVID-19 task force in Korean Society of Laboratory Medicine, and it's my honor to be invited to this meaningful conference to discuss aviation recovery on the COVID-19 pandemic. After the first report of the COVID-19, it became a pandemic during 2020. Currently, nearly 68 million people have been suffered from this novel infection, and about 1.5 million infected cases died of COVID-19. The world has entered the third explosive phase, and it is difficult to predict whether it will increase or decrease in the future. However, the situation of COVID-19 is very different among countries. The range of recent prevalence described as new cases per 1 million population is very wide, from 0.01 to 1,367, and there is a difference of 140,000 times in prevalence. After the first report of the COVID-19, it became a pandemic due to all the various factors involved in COVID-19 pandemic. Rapid transmission by disease characteristic is one of the biggest issues. This notorious disease can be impacted from a symptomatic patient or pre-symptomatic patient, and about a half of patients may be impacted from disease asymptomatic or pre-symptomatic patient. Another characteristics of COVID-19 is very mild symptom, even in symptomatic patient. In early stage of COVID-19 pandemic, high body temperature, sore throat, and shortness of breath are well known tried to suspect COVID-19 infection. However, it was reported that only 10 to 20% of patients may show these symptoms, and most of the patients can show very mild symptoms. So screening of COVID-19 by symptom is very difficult. And all of these transmission can be happened in very early stage by droplet transmission. Because of these characteristics of COVID-19, the only way to detect the patient is massive screening by epidemiological trapping. So, South Korea decided to carry out three main components to contain COVID-19, including massive diagnostic testing, isolation, and treatment and tracking. However, this strategy can be effective only in a closed community where there is no foreign import. If the foreign import can happen regularly, this import can be a cause of dissemination, and it can be a barrier for decreasing the epidemiological curve. So we should block the foreign import to contain the COVID-19 efficiently in community. For this reason, many countries implement containment measures, including self-quarantine for 14 days and testing for COVID-19 to block the foreign import of COVID-19. However, this containment measure can be differed by each country's situation and the proposed aviation and resource for the measures. And we also prepare the vaccine because several vaccines may be available in this December. At first, we should discuss whether we adopt containment for foreign travelers. In countries reporting a few COVID-19 patients and the percentage of imported cases is so high like A, the foreign import should be strongly blocked. However, in countries having so many COVID-19 patients and where the percentage of imported cases is so low like B, containment for foreign import may not be effective. So, foreign import-related containment measures should be determined according to each country's situation based on the COVID-19 burden and so on. In my thought, traveling from low to high prevalent countries does not require containment measures except for some political issues. However, traveling from low to high prevalent countries may be implement containment measure consisting of self-quarantine, pre- or on-arrival testing, and terminal testing, and so on. But this decision should be made according to each country's situation. If we decide to implement containment for foreign travelers, and then we should determine which containment measure should be used and Currently, 14 days of self-quarantine based on incubation period is widely used containment measures to prevent the foreign import. But the most prevalent symptom onset time is 3 days after exposure, and half of a patient may develop symptoms within 5 to 7 days. And viral shedding period is 5 to 10 days after symptom onset. So we can shorten the self-quarantine period in some cases if we mix the self-quarantine with the testing. If we shorten the self-quarantine period from 14 days to 10 days, and then we should endure about up to 10.7 risks in some cases. But we combine the 10 days of self-quarantine with RT-PCR testing, the risk may be decreased to 2.4. But we use antigen testing, the risk may equal to no testing. And this strategy can also be found in European guideline. If we use the shortening of self-quarantine with RT-PCR method, and then we can shorten the self-quarantine period from like this. So, to shorten the self-quarantine period, I would like to recommend only PCR test to rule out the COVID-19 infection patient. And we also should consider the pre-testing and vaccine. In pre-testing strategy, we should get the certification of pre-testing. And how can we believe the result of pre-testing? And how can we trust the certification? And finally, how we can share the information about pre-testing and vaccine infections. So we need a system for data sharing and certifications. This is my conclusion. Implementation of containment measures depend on each country's situations, and the period of self-quarantine can be determined by situation. But pre-testing, on-arrival testing, or terminal testing can shorten the self-quarantine period. And in this case, artificial tests should be used to decide to decrease the self-quarantine period. And also we need for preparedness for vaccinated person, for certification and data sharing. Thank you for your attention.
Thank you very much, Mr. Yong-Hwing. This is a great presentation. Thank you for that. Okay, we are a bit running out of time, but let's start now. Let's open the Q&A. Got a few questions to my guest here. Maybe we can start with the first question to Ms. Kyung-hwa. It is a question from the Japanese NTV. How seriously has South Korea's aviation industry been affected by the pandemic?
Thank you very much for the questions. Could anybody give us the second slide of my presentation? The second slide, you can see that it's focused on the passenger flights only. We have more than 90% decrease in international passenger flights, and we are experiencing, we are having approximately 50% of those in the air transport industry, they're on leave, and some airlines are facing mergers. I hope this will be the answer for this question.
Thank you very much, it's helpful. Just to save the time, I will move quickly to the next question, maybe for Javier. Are airlines currently getting the balance right between safety and recovery? Many people are using subways and buses and other ways of traveling and moving every day. How does airplane safety compare with other modes of transportation in terms of COVID-19 present risk? And by the way, this is a question from Xinhua News. Javier, please.
I think Hassan addressed it just now in one of the slides. Let's put aside the actual comparisons. I would not want just to compare because I do not know the risk neither in a bus, nor in a metro, nor in a subway. I think when one looks at Hassan's slide, it shows what is it every 2 or 3 minutes the air gets renewed in an aircraft, whereas in a hospital it's every 10 minutes. So I think that already answers how fresh the air is. Then we have I presume the question of proximity, where somebody is closer to you than it will be in a hospital because it's sitting next to you. Now, we have the debate early in the pandemic about the middle seat. Yet, one also knows of studies that because passengers are sitting looking front and now they're wearing a mask, I do not have myself access direct to the studies, but I have not seen any study or heard of any study that's saying that there is a high risk of contamination on a flight. In fact, if anything, there's few evidence that it has happened. So I would now also I think the question perhaps was also a bit tricky. What had this component of safety coming from aviation? I don't think aviation safety per se. So I don't think the airlines are sacrificing any safety at all. In that regard, so that I'm quite reassured. Neither are regulators. I talked about all the measures we're doing, so I'm not bothered. And I'll take the opportunity as well to address Professor Kwong. Thanks for those comments, which were very illustrative. And I want to share on a personal note, I think you touched the topic of narrative, and you joined this conference of aviation admitting that you're not an expert in aviation. I appreciate that a lot. When there is an accident of an aircraft, we know where the narratives goes. We have to fight, I mean, not fight, but we have to always counteract and remind people how safe aircraft are. I think, and the question I just got asked reflects this as well. We always have this narrative whereby because we are in an aircraft, it's more dangerous than anything else. And I think it is something we have to live with. And we're doing what we can, thanks to ICAO also and other institutions. But yeah, the narrative is an important one, and I wish it was addressed. Thanks.
Thank you, Javier. Thank you very much. I know that Hassan would love to have this question, but I have another one for him. Hassan, please, I got a question from Vietnam television. What should every traveler be doing to ensure their personal safety while flying?
It's a very good question. And as I mentioned in my remarks earlier, it is really a layered approach. As everybody has been discussing on this panel and the previous panel, no one solution is going to solve the problem, but a number of solutions working together can address this. Passengers, as the Flight Safety Foundation has stressed from the beginning of this pandemic, as well as all of the international partners, play a more important role now more than ever before in the entire ecosystem. And these are common sense, what we call the golden rules, that if passengers practice these, they can protect themselves and they can protect everybody around them. And these are some of the things that have been discussed in terms of hygiene, social distancing as much as possible within the ecosystem of the journey. If you are ill, do not travel, and many of those other practices that have been discussed. So if everybody does his or her role, we can all have a better, safer, and more hygiene journey.
Thank you very much, Hassan. I have here a question from Lee Ji-won, maybe for Sulman. Is there any suggestion to the government about aviation industry recovery from the standpoint of health science?
Difficult question, but as I said, we should provide more, we should persuade the public, and I think we can do that. Persuade the public and show them cabin environment and airport are safer. Safer than other public places. As I think that's scientific evidence, and we can convince them. But as I mentioned, the tougher challenge is that people do not travel not because of the concerns on the cabin environment airport, but when I travel to other country, whether traveling around that country is safe or not. So I think at least for a while, if for a businessman, they are willing to take small, even how much the risk will be, I don't know, but businessmen will be willing to take the risk, but the ordinary travelers may be still reluctant to travel. So I think there's two separate risks. One is a cabin or infections in those areas. The other one is if I go to other country, what should I do in the country? So, but in general, I'm a bit of critic of the social distancing because we should be have a more evidence-based approach. But in many countries around the world, they view social distancing from a very normative perspective. They just think that if we introduce more restrictions, then people's mobility will decline and infection will decline. Well, but we don't have enough evidence because we should take into account the human beings' social, economic incentive and motives. Like very poor people, they starve to die if they don't work. So for very poor people, daily workers, if government says stay home, does it work? that does not work. That's something like or social fatigue. So I think certainly for this COVID-19 policy, many governments and many people certainly have a very normative perspective and a bit of too high risk perception. But if we think and behave very rationally, then I think we can have a more targeted, more fine-tuned policy. That's what I can suggest to the government. More positive perspective, not normative.
Mm-hmm. Thank you very much, Soman. In the same line, maybe to also understand the perspective of the government, it might be a question to Yong-min or to Ms. Yonghua. It's a question from Mr. Mooney regarding the efforts. So, what does the government plan to establish a health safety culture?
Thank you very much for the question. The government is communicating with the industry during this pandemic situation, and will these efforts continuously in the future. And actually, we need the support from the industry to settle down the health safety culture in aviation. So we will promote the passenger also, but also communicate with the industry for the health safety culture in the aviation. And of course, we will also share the cases with the international organization and states partners like EASA and so on. Thank you.
Mm-hmm. Okay, thank you very much. I don't know if Mr. Yong-min has something to add on this question. Briefly, please.
In our country, the basic direction of COVID-19 containment is to minimize the COVID-19 patient because the expansion of COVID-19 patient can cost the many social payment. So the basic direction is the decrease the COVID-19 patient as we can as possible. That is our country's COVID-19 strategy, as I know. Thank you.
Thank you very much. Okay, so everything that has a begin has an end. So we can coming now to the end of this session. I would love to extend this discussion for hours, but we still have another session. There are other guests waiting. So thank you very much to all my guests and to the ones raising questions for our session. I have visited Korea in 2017. I had to moderate another session that time. Javier from EASA was also participating. It's a pleasure to always work with Javier in Korea. So that was that time for the 5th Flight Safety Seminar for CAA and operators in the beautiful city of Busan. I hope to visit Busan again after this pandemic, and then maybe to have another seminar in that place with all the guests to discuss the lessons learned after this pandemic. We were kind of taken by surprise by this pandemic. It should never happen again. And I think that there are many lessons learned. Thank you very much. Thank you, everyone. And I would like to give the floor now back to the host. Thank you.
Thank you.
Thank you very much for moderating and organizing the session. And I hope to see you again in Seoul too. And also our speakers, thank you very much for your presentations and answers. This concludes the session too.